question number 9. A 4-year-old boy with a history of cerebral palsy is brought to the neurology clinic by his mother with progressive tightness in the lower extremities. Although the patient has been intermittently undergoing physiotherapy for the past 2 years at a specialized center, the patient's mother is concerned he cannot yet climb stairs. The neurologist recommends a different treatment, which involves multiple IM injections of a drug in the muscles of the lower extremities to relieve the tightness. The neurologist says this treatment approach is also often used to relieve headaches and reduce facial wrinkles. Which of the following is the most likely mechanism of action of this drug? We've gone over this quite a few times in the previous classes, so this should be an easy one. Blocks the release of ACH. Okay, so this question, okay, so this was simple. This was botulism. We've gone over this quite a few times. We can go over it once more today. So botulinum toxin, it acts by irreversibly blocking the release of acetylcholine at the NMJ, resulting in flaccid paralysis, commonly known as Botox. It is used for cosmetic procedures like reduction of wrinkles as well as to reduce the hypertonia in spastic patients. The procedure involves multiple injections in the affected muscles. Its effect lasts for about 36 months, and then you have to give repeat doses. Okay, then toxic shock syndrome, toxin of Staph aureus. It acts as a super antigen. This is high yield to remember. The TSST toxin is a super antigen. So even low concentrations of super antigen can cause non-specific activation of T cells. Because of this non-specific widespread activation of T cells, there is such a severe sepsis, like symptoms in these patients. So this causes a massive release of cytokines, resulting in septic shock. Okay, then the ETEC is the heat labile toxin, which stimulates the adenyl cyclase by the ADP ribosylation of the GS protein. We've gone over this as well. There is that long table in first aid, so that's very high to remember. A reduction in the inhibitory neurotransmitters like GABA and glycine is the mechanism for the tetanus toxin. Okay, so the unopposed action of excitatory neurons causes muscle spasms, and EHEC, virotoxin and shigatoxin, they act by interfering with the 60S ribosomal subunit to decrease protein synthesis. So this is also a very important mechanism of action to remember, very commonly tested. EHEC, which is the virotoxin, and shigatoxin, they interfere with the 60S ribosomal subunit, decrease protein synthesis, and that's how they act. So let's quickly just go over this picture. We've gone over it quite a few times in the past, but we will go over it one more time today about the botulinum toxin. What it does is that it cleaves these snare proteins. These snare proteins are what helps bind the receptors on the vesicles and the membrane of the neuron, and when these bind, there will be a release of the acetylcholine. But if the botulinum toxin cleaves the snare proteins, then there is no binding between these vesicles and the membrane, and there won't be any release of ACH, and then there will be flaccid paralysis. Okay, and so that was about that. This is a very high yield questions because you need to know the mechanism of action of Botox, of tetanus toxin, and EHEC shigatoxin. These are some of the very important mechanisms to remember.
Thanks for watching. Please give a thumbs up and subscribe for more.